Good evening. Welcome to the Siddha-Vetha webinar series. So today, a very interesting topic. It was long due. This topic we were giving this in the form of course, but we haven't given a topic on autoimmune disease. Particularly, we did in this year. Last year, I think we did programs on autoimmune and also on workshops we did. But here we are talking about an important topic today is Siddha solutions for autoimmune disease. So what are the solutions that Siddha has already for autoimmune disease? Is a very important topic. And today's speaker is Dr. Kayalvizhi. Dr. Kayalvizhi is an expert in treating autoimmune disease. So she has a BSMS in medical, and she has a medical vastu. She's a medical vastu expert. She has completed her bachelor's in Siddha from Velumailu Siddha Medical College, situated in Tamil Nadu. After completing her bachelor's, she has practiced as a Siddha doctor in a reputed hospital for 3 years. Later, she has started her own Siddha clinic and successfully she has been running it for the past 7 years. She is expert in treating patients with chronic disease such as psoriasis, diabetes, and autoimmune disease. That includes rheumatoid arthritis and SLE with a good rate of success. Her research interests are in the area of motivational healing in incorporating Siddha with Vastu, which is a very unique field. Most of the medicines needed are prepared by herself. Her Siddha medicines ensure good quality control. She has experience over 10 years in the field of Siddha medicine. So I welcome Dr. Kayalvizhi to start our session.
Thank you, sir, Dr. Sean, for introducing to this webinar series. Hi, everyone. I think all of you joined the webinar series. Welcome to Siddha-Vetha community webinar series. Today we are going to see about autoimmune disorder and the solution for autoimmune disorder. So wait for a second. I'm going to share my document here. Okay. Okay, shall we start? So we are going to see about autoimmune disease and Siddha solution for autoimmune disorder. But first, what is autoimmune disorder? Autoimmune disorder is a condition in which your own immune system mistakenly attacking your own cells or tissue, thereby creating a lot of damage to your organ or system. So the immune system in our body has a good role to play with your body. It continuously guards all your cells from germs and foreign invaders or pathogens that can enter into your system. So what happens when a germ or foreign invaders enter your body? Not only the foreign invaders like germs, there are also harmful metabolites that form during the metabolism of during your metabolism or the digestion of food. You may get a harmful metabolite. The immune system immediately send fighter cells like natural killer cells and lymphocytes, and so many immune cells are there to counteract the action of germs or foreign invaders and to nullify the effect of harmful effect of the germs. So, but in case of autoimmune disorder, the thing is different. In autoimmune disorder, what happens is our own immune system produce auto antibodies against our good healthy cells and tissue to attack and create some more problem, leading to some deformities or some organ failures too. It is very important to discuss about autoimmune disorder because now the autoimmune disorder is in the progression stage. For example, in United States alone, some 50 million people are affected by autoimmune disorder. In that, it is a major health crisis in United States. If you see the entire population, about 14% are affected by autoimmune disorder throughout the world, whereas in United States the incidence is very large. Before 30 years, if you take the statistic, before 30 years, for every 400%, one is affected by autoimmune disorder. But nowadays, it is for every 30%, one got autoimmune disorder. So it is very, so the autoimmune disorder in a good progression stage. So we have to control the autoimmune disorder. Before 30 years, there are so many infectious diseases, and now the society is well developed and well civilized. It know all the thing about hygiene, but autoimmune disorder is in the progression. So there are about 140 plus autoimmune disorder are there, but the very common disorders are rheumatoid arthritis, psoriatic arthritis, and some thyroiditis and inflammatory bowel syndrome. And there are a lot of common autoimmune disorder affecting our body. So it is important to discuss about autoimmune disorder now. When people are diagnosed with autoimmune disorder, the doctor used to tell that the reason for this disease is unknown, but it's not actually true, because we have in Siddha literature there is a clear evidence for the incidence of the disease. The etiology is very clear in Siddha system, but in Western science they fail to express why our immune system is acting in a different way, why it is going to affect your healthy cells. So the Western science still now trying to prove why it is acting like that. But in Siddha system, in Siddha literature, there is a clear etiology for this disease. Let me see in detail about the etiology which is mentioned in Siddha literature. But there is no separate category like autoimmune disorder in Siddha literature, because, for example, if you take rheumatoid arthritis, it will come under the 80 disease of Vata. If you take psoriasis, it will come under skin disease. But whenever the system is mentioned, whenever in Siddha literature they mentioned about autoimmune disorder, they used two important word for describing the etiology. The first I'm going to tell you the karma theory. It is whenever they come across the autoimmune disease, they mention it as karma noi. When I use the word karma is a broad spectrum word. When I use the word karma, it is not about the sins or sorrows, or not it connects with rebirth or something else. For example, for describing, for example, where shall I'm going to take one of 8 things for describing the karma. I'm going to take angry. If you get angry, the angry should be expressed in a controlled manner. If it is not expressed in a controlled manner, then it is going to be a karma here. If one person is getting angry, it should be expressed in a controlled manner. If it is over expressed also, it is a karma. Because if you express it overly, the system is going to act in a different way. Your electrical impulse is going to affect all your ecosystem in our cells of the body. Because our human body is not a single structure. It is about millions and trillions of cells working together, and they love each other. The cells not only love each other, the cell also love the person to whom you are quarreling or fighting with. So you are inputting some artificial electric impulse inside your ecosystem of the cell. So what happens is it will create some inflammatory process or autoimmune response there. So so the angry should be expressed in a controlled manner. In the another hand, if the anger is not expressed, it is also going to become depression and again going to create the anxiety disorder there. Then it is also a karma. So we all should have a control over all they mentioned a important 8 things that are going to cause your karma. In Siddha, the in Tonutaru Tattvangal, there is a separate category which is called as Raham Yettu. I read all those 8 things. The first one is Kamam, which means lust, Krodham, that is angry, and Ulobam, which is being greedy, and Moham, uncontrolled desire, and Madam, disobedience, and Macharyam, being hostile, and Tunbam, oris, then Ahangaram, it is about jealous. So if one person is very controlled, we are expressing control over these 8 things, there is no going to be no karma. But if you are over expressing or under expressing these 8 feelings or 8 things, then there is going to be a karma. There will be going to disturbance in the ecosystem of the cell, thereby creating an autoimmune response. And the next important thing, when we come across the Siddha literature, wherever the autoimmune disorder is mentioned, they also mentioned an important wording which is called as uyirin arivu kidudal, which means uyir here refers to the cell, and arivu kidudal, which means the disturbance in the cellular intelligence. What happens when a cellular intelligence is disturbed? We all know every cell have a certain type of intelligence. It know what are the things have to get into the cells and what are the things which are not allowed inside the cell. Every cell have some cell membrane. Those cell membrane here act as a brain for the cell. It know what are the function that every cell has a function. It know the cell membrane informs the cell how to function and carry out the daily process. There are a lot of factors affecting this cell intelligence. When cell lost its intelligence, it is going to act in a different way. It will allow all those harmful metabolites inside the cell. Thereby, the immune system find it as an foreign antigen or something and going to destroy your own cell. These are the two main etiology mentioned here and Siddha literature. There are also more things about etiology of autoimmune disorder. So the important 2 things are the karma. It is defined as a karma noi, and the second one is the losing of cellular intelligence. So in any factor that is contributing to the disturbance in the cellular intelligence, the cell is going to act in a different way, or it is going to allow the harmful germs inside the cell or harmful metabolite into the cell, thereby becoming a non-healthy cell. So in turn creating an autoimmune response or disorder. The prolonged cell intelligence loss will definitely give you an autoimmune disorder. So these are the main 2 reasons. Now we are going to the next topic, the other major factors contributing to autoimmune disorder. Nowadays, in the developed society, which is very hygienic and very civilized, the children are brought up in a very, very safest environment or very clean environment. They are more knowledge about hygiene. We are using all those disinfectant and antiseptic solution, that and all. The children were not exposed to germs. I want to tell an important clinical experience here. For describing here, I'm going to take rheumatoid arthritis as a prototype, or for example, the common incidence age of rheumatoid arthritis is some 30 to 40 years. The incidence of in the middle year, that means childbearing years. But nowadays, I am seeing the patient in their early 20s and even before 20s, they are getting more number of autoimmune disorders, including rheumatoid arthritis. What is the wrong with the system here is, where children in their younger age or grown up in a protective manner or in very hygienic manner. Our children are not exposed to germs. When the children are exposed to germ, your immunity, every cell in our body has to do some work. But if the immunity cells are not allowed to function its work, then it's going to affect your healthy cells. So we also know that our immunological system possesses some unique features of creating memory cells. For describing that one, if a germ enter into your body, the immune system will send natural killer cells, and also it form the memory B lymphocytes or memory T lymphocyte, because if the second time if the infection occurs, it need not to analyze the protein quota, right? Do not know it. It won't going to do all those findings in the antigen and going to nullify the effect. So it will create beta lymphocytes or memory cells. That memory cells will be in your blood for about for a decade. It's a decade for about 10 to 15 years. It is going to be in your system. So what happens when you are too hygienic? It is good to be clean, but not too clean. When you are using all those disinfectants and all those hygienic product antiseptic solution, then you are not allowing your immune system to function properly, because all system will be in good function in the early age of person. So it is called as hygiene hypothesis. And another important thing is overuse of antibiotics. What happen when if your child is getting a common cold or a simple viral fever, the children is provided with a broad band of or broad spectrum of antibiotics, which is going to suppress your immune system. Your immune system is not allowed to do its function. So the weakened immune system is going to stimulate or is going to create a autoimmune response, or the unused immune system is going to affect your healthy cell. This is why the autoimmune disorder is in the progression stage. There are so many children who are getting the psoriasis or rheumatoid in their early ages nowadays. The incidence is preponderant here. So it is good to be clean, but not too clean. And also the antibiotics we are using is not good for. It is also, it is going to destroy all the good bacteria also inside your gut. Gut health is a very important, because gut gut is going to give you 80% of mucosal immunity. Your 80% of 80% of immunity is lying in their gut. So gut health is very important. The antibiotics we use is going to destroy all the beneficial bacterial flora in the system. So limiting the use of antibiotics will prevent you from autoimmune disorders. So so there are also so many factors contributing to the autoimmune disorder. This is also mentioned in Siddha literature in detail. We are going to see one by one. So first thing is food. Nowadays, food is become the major factor for many number of diseases. The Western diet, which is consists of so many trans fat and sugar, high sugar and highly processed food, and the food with a lot of preservatives, is going to affect your gut health, and thereby creating some inflammatory reaction inside your body. So the inflammatory reaction will definitely stimulate your autoimmune response. So prolonged eating of undigested or partially digested food will affect your gut health, thereby giving you a leaky gut. There should be a balance between harmful bacteria and beneficial bacteria in your gut. When the harmful bacteria is tend to grow or magnify or multiplies in your gut, definitely the inflammation process is going to initiate it. Then immediately in turn it is going to activate your immune response too. So food is the main thing here. Not only the what the food we eat, it is also about the mind or mentality or mood while eating your food. Sometimes it happens to all. We are supposed to eat some Western diet. That time we should not eat with a feeling of that I'm going to get disease or I'm going to gain weight or this food is going to affect my gut, like that. Whatever food you're getting today, have to eat with gratefulness or with gratitude, because you're inputting your system about, because you're inputting your system with artificial knowledge that this food is going to create some problem. So we should not eat with that feeling. So next thing is free radicals. You know, the Western diets or preserved food consist of so many harmful chemicals, which in turn are going to give more number of free radicals. Free radicals are the substance which are which are ready to give electrons immediately and bind to a healthy substance in your body. For example, if a free radical is going to give electron and attach to a cell membrane, it is going to destroy all the macromolecules and the healthy things inside your cells. So thereby what happens here, the healthy cells get damaged and it allows all those harmful metabolites inside the body. So automatically the immune response is going to start. So if you're taking good food also, you have to check about the antioxidant and nutrition property. If a leaky gut cannot absorb the nutrition from your food or whatever you take, you cannot absorb the energy or nutrients. The second thing is unused energy. What is unused energy? How unused energy is going to cause the problem? Every person should be balance their mind and physical energy. Nowadays, people are very overusing their mind power. They are continuously planning for their work or their official work, but there are no lack of physical activity. What happens when you overuse your mind power? It will create your physical stress here. The physical stress should be exhausted by definite physical activity. If your physical stress is not exhausted properly through physical activities, it is going to become the emotional stress here. So the emotional stress is going to create an anxiety disorder. We all know the anxiety is a major cause or a major triggering factor for autoimmune disorder. So it has to be maintained, the balance has to be maintained properly. Um, the next thing, the anxiety also weaken your immune system. It is going to, because during anxiety, the large number of stress hormones like the fight and fright hormone, adrenaline, cortisols are going to increase in your blood. What happens when that hormones enter in your body, that all the blood from your gut will be forced to the muscle, and what happens, it will increase your heart rate and it will going to use all those energy, thereby suppressing your immune system. So the weakened immune system going to act in a different way. This is also the main cause of autoimmune disorder. So every person should have a control between the mind power and body power. In another hand, some of the people are overworking with their physical activity. They will do more number of physical activity without any relaxation for their mind. What happens here? Here also the emotional stress builds up, and the emotional stress in turn is leading to anxiety. In most of the culture nowadays, there is no room for expressing the emotions here. In Western culture, even laughing loudly is considered as a problem. Even talking loudly is considered as a problem. Everything is considered as a problem here. When there is no room for expressing the emotion, I already mentioned about that Raham Mete earlier in the presentation. If there is no room for expressing worries or whatever the feeling, it is going to cause an agitation in your cells. The cells are going to um, express or different electric impulse. So mind will observe all those electrical impulse, and it will activate the immune system in turn. So you should be have a good control between the mind and body. And the next important thing is lack of sleep. Lack of sleep is not only the causative factor, it also triggering factor. While we are treating autoimmune disorder, the main thing affecting the prognosis of the treatment is the lack of sleep here. Because when one gets sleep, what happens in their body? If you are awake, most of your energy are used by muscle and the brain when you are awake. But when you go to the sleep, or when you are asleep, where you will get the energy distributed. A portion of energy will be utilized by the immune system to kick out the older ones which is not functioning, older cells which are not functioning, or harmful cells which are not functioning, and it will create own cells. Okay, most of the people who are affected by sleep apnea don't know they are the victim of sleep apnea itself, because they can't find the difference whether we are getting good sleep or not. Later in this presentation, I will tell how to find you are sleeping at a right time, or sleeping in a light manner, or like that. So what happens in your sleep? During sleep, lot of stress releasing hormones are released in your system, and also the immune system stop circulating inside, stop circulating in blood, and it will get lodged in lymphocytes, and doing all those repair activity in the cells, and also it will prepare for the next day work. So sleep is a very important factor here in autoimmune disorders, because most of the time when the patient before a week or a month before the incidence of autoimmune disorder will complain about the sleep or lack of sleep. So your sleep pattern should be observed properly to avoid autoimmune disorder. These are the main things mentioned in the Siddha literature about autoimmune disorder. So we will move to the next thing: how to prevent autoimmune disorder. The important thing nowadays is people are more aware about the disease. The people should know the difference between the awareness about the disease and awareness about the health. For example, nowadays the person, when they got a small tenderness in their fingers, they directly go to the lab and do all those investigation, are effector or anti-nuclear bodies, and to some extent, some people will take X-ray, PET scan, and even some patient will come with the tumor markers. So all this because of over knowledge about the disease. And what happens here, the symptoms is not same for all the patient. It's not going to express in all the patient. The symptoms may vary, and they come to the clinic with all those diagnoses, and if they are tested positive for RF factor, then again they will go and read all those things in media, and they will consult the Google doctor for about the symptom, and whatever the content or present in the internet, they will go on learning. So will they impute an artificial knowledge or input the system to function like that? For example, if they got tenderness, they will input the system like next week I'm going to get inflammation, and the next week I'm going to get morning stiffness, so the next I'm going to get deformity, or I'm going to get I'm going to be in the bedridden. So it is a very wrong thing. The awareness about the disease surely give you the disease, but the awareness about the health is very important. So everyone should know about the difference, because our subconscious mind is alert all the time. It will record all those pessimistic view of the disease and all those optimistic view of the disease. So it will record all the things and impute your system. So indirectly what you are doing is you are manifesting the disease into your body. Okay, and you're going on the manifestation process. The person is going to attract the disease towards themselves. So don't be so aware of disease. Be aware of our health. And then the next question rise. I'm already, my mind is, I'm conscious about the disease. What we have to do here is for um, for recovering from that over knowledge or over learning, you have to hear a lot of health affirmation. There are a lot of health affirmation in internet. You can check in the YouTube. The health affirmations are provided with a certain meditation music. What happens when you hear to this health affirmation? It slowly, it will slowly rearrange your subconscious mind from pessimistic to optimistic view, and it give a strong belief of health. But the only thing while hearing health affirmation is that you should hear in, as a background music, or you should hear but subconsciously. But no, it should not be heard with consciousness. You can hear while you are doing your work, while you are cooking. You can hear as a background music while you are doing some other task like walking. You can hear, because our subconscious mind is awake all the time. It will gain all this knowledge. It is going in the background. So this method will clear you all those unwanted learning about the disease. So over learning about the disease should be done to prevent the autoimmune disorder. Not only autoimmune disorder, all disease. So don't get more knowledge about the disease. And the second important thing to avoid autoimmune disorder is getting adequate amount of sleep. Now, already I told the importance of the sleep. Now I will get to the important thing: whether you are sleeping at a whether you are sleeping in a right manner. For that, the scale is very easy. When you get up from your bed or when you awake, if you feel energized to work or you feel motivated to work, then your sleeping pattern is good. Some patient, mainly the patients who are affected by autoimmune disorder, will complain, or the person who are going to get autoimmune disorder will complain this one, that they will feel fatigue in the morning itself, or they feel tired even after 6 to 7 hours of sleep. So the sleeping pattern should be observed and corrected immediately. The sleep apnea patient are very prone to heart disease, and even autoimmune disorder incidence is high in the people who are affected by sleep apnea. So nowadays there are a lot of tests for testing their sleep pattern. We can conduct a sleep study so that your sleep pattern can be managed properly. So get a good amount of sleep to prevent autoimmune disorder. The next thing, eating a lot of calming food. There are a lot of calming food in our traditions. For example, already we had a session about the fermented food like probiotics. What is the function of probiotics? The fermented water, rice water, is what is going to do in your system? It is going to maintain the bacterial flora. There are about a million and trillions of cells in your gut, good bacteria. So it is going to maintain your bacterial flora inside your gut. And the next thing about food is the food like ghee and coconut milk. And there are so many foods like tender coconut water and and the buttermilk will have the calming effect in your digestive, in your GI tract, that is gastrointestinal tract, thereby preventing the inflammatory process. And it also have a immunosuppressive action. If the intestine is good, your immune system is also going to be good. So eating a lot of calming foods will prevent you from autoimmune disorder. And you have to eat with right mentality, with gratitude and all. Please avoid more preservative added food and more processed food and Western type of diet to prevent you from autoimmune disorder. And involving in regular required amount of physical activity. What is the required amount of physical activity? It differs according to dehis. In Siddha, we we differentiate or we categorize the patient according to the body type. For Vata-Degi, the physical activity will be different type. For Pitta-Degi, the physical activity will be different type. When you're going to start a physical activity, consult a doctor for doing a physical activity. For Pitta-Degi, overworking will create problem. So everyone should have a uh, categorized method for physical activity. So physical activity is very, very important to eliminate the physical stress or emotional stress inside your body. And another important thing to avoid autoimmune disorder is forming emotional bond. I already told that nowadays there is no room for expressing the emotion. This is going to create so many problems. For that, you can make a emotional bond with a pet, or you can do gardening, and you can do things you like. For example, you can go for hiking, or you can go for long travel to tackle with your emotional stress. Another thing, the spiritual praises also have the calming effect on immune system. Whatever the religion you may be, give a regular visit to a spiritual places, because the spiritual place are having a calming effect in your immune system. Then the last thing for preventing autoimmune disorders, avoiding stress and depression. So what happened during stress and depression, we already discussed previously. So you should avoid stress and depression to prevent autoimmune disorder. While discussing autoimmune disorder, the another one important point I want to tell you is that the women are very prone to autoimmune disorder. For every 10%, one is woman, or 80% of population in autoimmune disorder is the woman population. Why this happens? There are two important reason why women are getting so many autoimmune disorder, like rheumatoid arthritis, even the hashimoto-thyroiditis, or some pernicious anemia. The women are very prone to the disease. This is because of the X chromosome. That there is a pair of X chromosome in the in a female. Because of this, the X chromosome is mainly concerned about the production of immune cells. But the female are very susceptible or very strong against the infection, but they are paying heavily in autoimmunity. And another important thing, why humans are getting affected by autoimmune disorder, is the estrogen here. Estrogen is going to create autoimmunity, whereas the androgen is going to calm your immune system. This is why the women are very prone to disease. So the female population are women who are present here. I request to follow all these things to avoid autoimmune disease. If even if you are diagnosed with the autoimmune disorders, don't go for searching about the symptoms or treatment method or something else about the disease. And please stop talking about the disease and concentrate on your health. These are the things uh, have to be done to prevent autoimmune disorder. Then and then the important thing, the Siddha solution for immune system. Okay, if a person is affected by autoimmune disorder, whatever the autoimmune disorder may be, the treatment is very, very simple. What happens in autoimmune disorder? First thing is harmful metabolite or free radicals or in your system, or some autoimmune response or in your system. The autoimmune response in turn is going to create the energy difference in Vata, Pitta, and Kapha. So the first thing we have to do is detoxifying at regular intervals. By detoxification, the early mentioned harmful metabolite or free radical are eliminated from the system, therefore helping you to come out of the disease. So the detoxification process also differ from person to person. If it is a Vata Dehi, the doctor will advise to give purgation at regular intervals. For some people, it may be induced vomiting. So, detoxifying your body at regular intervals. The detoxification topic itself consists of large number of process. So, when you are diagnosed with an autoimmune disorder, you have to consult a doctor for detoxifying your body first. This is the first and foremost thing in the treatment. And the second thing is practicing daily regimen, which is in Siddha it is called as Nal Ulikam. Here, what the doctor will do, he will give a list of things you have to do starting from the brushing up to you are going to bed. So the doctor will inform you what are the things you have to use for even brushing, and what type of food you have to eat. It also differ from a person to person, and also it differs from a disease to disease. For rheumatoid arthritis, it is a different type of daily regimen. For psoriatic arthritis, it is going to be different regimen. For a psoriatic arthritis, they will inform you to take salt water bath and so many things. Even the type of vessel also for cooking food also taken into consideration. So there is a lot of protocols in treating the autoimmune disorder according to DEHI. So when you're diagnosed with your autoimmune disorder, go for a doctor and get your daily regimen or a Nal Ulikam to it is like something like a lifestyle modification. If you are doing that one properly, you will get almost 70% of your disease will be get eliminated naturally. And the third thing, balancing Vata, Pitta, and Kapha. You all know that in Siddha, all type of diseases, starting from common cold up to cancer, all are treated according to the variation in Vata, Pitta, and Kapha. In autoimmune disorder also, in one type of autoimmune disorder, the Vata is going to get affected. In some of the autoimmune disorder, the Pitta is going to get affected. So the doctor will analyze your body type and nadi, and he will give medicine according to or he or she will give medicine to balance your vata pitta kapha, thereby bringing you out of the disease. And next important thing is there are so many miracle herbs in our system to for autoimmune disorder. For example, we can take Bacillus cereus or ashwagandha, or it may be turmeric or ginger, which are having a very strong action on your immune system or autoimmune response. For example, ashwagandha will act in a dual method. For example, if your immune system is weakened and it is suppressed, it will activate your immune system to function normally. On the another hand, if your immune system is overdoing or doing some wrong things or overdoing its work, the ashwagandha will have the calming effect. It is a miracle drug. It has both the dual effect for calming the immune system and also for stimulating the immune system. So, uh, in case some people will have a doubt, in advanced stage of autoimmune disorder, the people will have the doubt, will Siddha be effective for advanced disease? For that, I am going to, I am a victim of Guillain-Barré syndrome. I came out with our medicines, with our Siddha medicine only. I am treating more number of patients with rheumatoid arthritis who come to clinic with all those advanced stage, with all those deformity. There is a miracle process in your system, which is called as rejuvenation. When a cell is getting so much of damage in our system, we can able to rejuvenate each and every cell in your body to do the normal function. So when you consult a Siddha doctor for autoimmune disease, or not only Siddha doctor, Ayush doctors, you should be 100% believe for the system. You should not have a plan B. If it is not working, I'm going to consult allopathy. Don't go with the plan B for consultation. There are so many miracle treatment in Siddha system, there are a lot of perumarundugal also for treating autoimmune disorder to a greater extent and give a success rate. And the next thing is asana and pranayama. And there are a lot of even meditation like anakata dhyanam and all to keep your body and mind in a balanced way. There are a lot of asanas which is going to give a heating effect in your body, lot of asanas that is going to give a cooling effect. So before starting the asanas, get a consultation with your doctor. What are the asanas you have to do if you're diagnosed with an autoimmune disorder? Otherwise you can do all those asanas alternately. So whenever you are diagnosed with the autoimmune disease, get a list of asanas and pranayama to increase your pranic energy, because the karmic bondage will be reduced by doing asanas and pranayamas. So the pranic energy will definitely give a relief to your autoimmune disorder. And as Dr. Sean mentioned, I am traveling with a set of people who are very experienced in medical vastu. Medical vastu is a very broad spectrum of a word. It is a vast thing. So now we are talking about autoimmune disorders. So let me tell one or two points about medical vastu here, because it needs a lot of time here. So regarding a disease, whatever the disease may be, not only the autoimmune disease, if a person is experiencing any disease, the east direction or a east direction of the house should be noted properly. The windows in the east direction should be kept open, because all we know that our earth is not upright position. It is to 23.5 degree, slightly it is tilted. So you should get good amount of sunlight and aeration from the correct side. So east direction should be um, should be watched properly for the well-being of the person in the home. The east direction window should be kept open as long as possible to get rid of the disease to the person inside the house. So we are talking about autoimmune disorder. The depression and anxiety disorder are the main cause of autoimmune disorder. So in a house, the northwest part of the house is for the mental health. So the people who are affected by autoimmune disorder or depression or some psychological disturbance, the person should have clear northwest region, because northwest region is for mental health of the patient. So I'm going to conclude my presentation here. There will be a question section. You can ask your queries about the presentation, and you can ask your doubts about the autoimmune disorder. I
Okay. Thank
Thank you,
you.
Dr. Sean, for this wonderful opportunity. You can ask your question now.
Okay, thank you so much. I just wanted to make a quick announcement because of the, so today's sponsors are Nature's Best. It's a company that is selling very natural products, food, other oil, rice, millets, all this wonderful products. So if you can check their website, it's naturebest.com. So if you wanted to, buy, avoid products such as, the what doctor was mentioning, we wanted to promote all kind of natural products, people who have things that are not available. So we want to promote every week. So this week we wanted all of you to be aware of this company called Nature's Best. So thank you. So you continue. I'll open for questions. If you have any questions, you can raise your hands and I will open you. Any questions? It's a very important topic, and you should have a lot of questions, I believe, because doctor has given very important points today. And one of the things he was mentioning, I think maybe we can even, if you don't have, there are some questions. Is there a solution in Siddha-Vetha for all treatments? We check. Is there a solution in Siddha-Vetha for all tree nut allergies? Okay. So she's talking about nut allergies. Is there a treatment? So we request you to be, take the today's topic. Based on today's topic, we can ask the question first, and then we'll discuss other kind of questions. First, based on the topic, what topic we covered on the autoimmune system, we'll discuss, and also there is connection between that. But if it is not, we'll postpone. So yeah, so we can take by that order we will go. Doesn't mean we cannot answer, but it takes a while for that. Okay. So how to avoid atopic dermatitis in point of your view? Well, that's also another. Is it related to autoimmune?
Yeah, it is all related to autoimmune disease, sir.
Yeah, go ahead,
What
please.
I have mentioned is not for, it is common for all autoimmune disorders. In case of atopic dermatitis, first we have to calm down the triggering factor. There are so many triggering factors going to affect your dermatitis. For a smoothing effect, I will give you two important home remedy. You can have a good Epsom salt bath for getting your atopic dermatitis cured. And there are a lot of medicines, and also you can take a more amount of probiotic food. So what going to happen if you take a large number of probiotic food? Your purification or your scaling is going to get reduced, and get your detoxification at regular intervals. These are the things we can do for atopic dermatitis. What I mentioned in solution for autoimmune disorder, you can follow all those things. While talking about atopic dermatitis, your lungs also should be taken into account, because oxidative stress will increase your dermatitis. So consult an Ayush doctor to what are the things you have to follow, what type of things you have to eat, because dermatitis here will flare up when it is exposed to some stimuli or triggering factor. So you have to consult for the regular detoxification process, and what are the, you should avoid all those chemical stimuli that you are going to use on your body. So that's it, sir. What is the next question? Shall I go for the next question, sir?
Yeah, go ahead, please. I will open the people who are in have questions. Okay, you go ahead, please.
If foreign antibodies can trigger autoimmune, can taking vaccine to trigger autoimmune? Yeah, there is a big conflict in the medical field about vaccines. The vaccines are weaken antigen to trigger autoimmune. Even autoimmune can be an important cause, uh, can be occur when you are going to take vaccine also. I am okay, wait, okay, I am going with your point. Surely vaccine will trigger the autoimmune disorder. I'm telling it boldly because I am against vaccination. So I will tell vaccines are also an important factor for autoimmune disease. So the next question, for a person who has hypothyroidism, is taking allopathy medication for many years, is it possible for a person to get rid of the medication totally and come out of it? Yeah. Very good question. The people who are suffering from hypothyroidism, there is an immune attack which is called as acinomatotyroiditis, which is the major cause of hypothyroidism in all over the world. By taking allopathy medicine, you should not stop allopathy medicine immediately, because it will have some adverse effect when you stop the medicine immediately. So you have to consult an doctor, and the doctor will give you the medicine to rejuvenate. What happens in hypothyroidism, the large number of metabolites or harmful things will stick into your thyroid tissue, and going to attack your thyroid. You have to detoxify all those things, and then your thyroid is going to function in normal way. Then only you can take T3 to 4 THS, all those tests, and you can be on you can leave your allopathy medicine, no problem. So the next question.
Yeah, this is Vishnu. Thank you, doctor, for all this information. It is really helpful. So I have one question regarding ashwagandha. So you're talking about ashwagandha, right? So you mentioned that ashwagandha has a dual effect. When we have some problem, it will calm. Yeah. And if it is overworking or if it is not working, it will do the reverse effect. So, but when I was Googling, I'm getting a lot of wrong information maybe. So they are saying, especially for autoimmune disease, ashwagandha may give a reverse effect. It will not help, it will increase it. So just want to confirm it back with you about this dual
Okay,
effect.
thank you. I earlier mentioned stop Googling about, I don't know who are writing this content. We are clinically experienced. We are I'm 10 years experience. I'm going on giving medicine and going to collect all the clinical data. So ashwagandha is amphometric effect. There is dual effect. You can use ashwagandha. Definitely, it won't cause any reverse effect.
Okay, thank you very much.
It won't cause any problem.
Thank you, doctor.
Thank you.
So within, I got one more question. So within ashwagandha, so there are some products like KM66 or something.
Yes, there are some cytokines, but what happens? Yeah, herb contain lot of phytochemicals. But what happens in your system when it is given in a medicine form, or when it is given in a assimilatory form, the good things is going to happen through the process. All those cytokines that going to cause you disease will get destroyed. Don't worry about the adverse effect of ashwagandha. So only I'm telling that you have to take the ashwagandha in a processed way, that is in medicine alone. I'm not insisting to take the raw ashwagandha or like that. I mentioned for the immunosuppressive action, you should take ashwagandha in a medicine form. The doctor will give you with the honey or ginger juice. So he know the dynamics and all. So it won't affect your system.
Okay, thank you, doctor.
So he said.
Next question, Ashwini, you have a question?
Okay. Yes, Ashwini here. Thank you for your presentation. It was wonderful. Just a quick note, when you started the presentation, you had contradicted, or not, you had compared the advancement in people's health nowadays, right? The decreased incidences of communicable diseases and the increased incidence of non-communicable diseases. And then in the end, there was a comment about the ill effect of vaccinations. Don't you think you're contradicting a statement? Because the very reason the world has seen a decreased communicable diseases is vaccination, along with, all the other lifestyle changes. Who just declared the last case of polio, wild polio in Africa? So is it not demeaning to the modern science by making a statement like that?
Okay, you're asking that. First I mentioned it as it is the infectious disease are controlled nowadays, and finally while answering about vaccination, I told about that is very worst. So you are asking the same question. So the answer is the vaccination is good, but it is not advisable according to the Siddha system, because our own system is enough to delete all those infection getting into your body. Because you are talking about polio. During the polio stage, no medicines were taken from Siddha side. So I think vaccination is plays important here.
So
Thing I told about vaccination is my personal point.
yes, you can tell your personal point. I think that's absolutely fine. I mean, people have the right to tell, and nobody can force any system or government or you have your personal perspective. That's absolutely fine, and that's what we want. You know, it's okay to have a personal perspective for vaccines. And yes, definitely we don't have, because I think the problem is that um, we haven't looked from a Siddha perspective of learning science and technology. So I mean the medical science. So so if we have learned that way, I think using what is immunity, the meaning of immunity from Siddha perspective, then definitely we already have Urai Matre. We are giving little bit, all things that are needed for a kid in different format, and we really don't need that's kind of a vaccination that we are already doing in our system. So therefore, we really don't need this. But for Western people, I think because there is nothing else but there for the West, I think that is okay, because that's how it is functioning for a fast food kind of community, is the fast food medicine. I think for people who are built from immunity, it may not be compatible for people who are eating that our kind of diet. I think that's what my opinion is. But you cannot say it's not going to be helpful for people, outside the country or other cultures. I think this for people who really practice in our culture, very traditional fraud, how they bring the kids by oil bath and other kind of thing, then definitely I think we don't need, vaccines for that kind of kid, because their immunity is already built. And it also depends, as the mother giving milk, and how they're raising, from the beginning, if they have done some exercises like Kaya Kalpa, or they have taken, the mother parent has taken good food, then definitely I think your point is well taken, doctor. So I totally, yeah. Okay, any other questions? We are running a bit late. Yes, so we have a system. So somebody is asking how to consult a Siddha doctor. So we have a system to open up. That's the one of the reasons we are inviting people. So we will give you group consultancy, so we can approach Siddha-Vetha, info@vetha.org, and we will arrange the doctors for you, and we'll have experts, whatever expert service we need. We wanted to, and not just one doctor, we have many doctors who will give their collective opinions. So you will have different perspectives. So each perspective will be different from person to person. You can take a collective perspective and you go by your own kind of thing. So yes. Okay. The next question here. Okay, you wanted to read, Dr. Kayalvizhi, you wanted to read, or you want me to read
So
the
you
question
can,
for you?
how to consult a Siddha doctor? You answered that question.
Yeah, I just answered that. The rest one, hair fall.
Is there any treatment for Lyme disease? Yeah, there is a lot of treatment for Lyme disease. as already sir mentioned, you go and consult with the doctor board there and get treated. So I can't tell all those perumandigal from here or all those protocol from here. I have to consult a doctor in person.
Yeah. Okay. All right. So we hair fall background. So did you answer the question, ma'am? Hair is falling or balding without,
So,
you know,
see the question.
genetic background. We considered autoimmune.
Without genetic background, we considered autoimmune disorder or any other. So hair fall nowadays is influenced by so many factors. Not only the genetic factor, you are going on using all those chemical substance in your hair, and the chemical substance sometimes will going to act like a stimuli and will create autoimmune response also. If you are having more hair fall, you have to check your nutrient content and hemoglobin and zinc percentage in your and selenium percentage in your diet. And not only the hair fall is because of autoimmune disorder, there may be nutritional defect or some other pressure, stress condition also will give you a hair fall. So when you are experiencing hair fall, first you have to practice the some asanas or pranayamas. If you are getting good prognosis, then you have to continue that, and you can use some medicated oil for your hair. It need not to be an autoimmune disorder.
Okay. Okay. Well, I think we should wrap up. It was a wonderful, eye-opening session for all people here, I think. And thank you, Nature's Best, for sponsoring this program today. And you'll visit Nature's Best, the website. And, so we want to promote these products. We want to promote our, the Siddha doctors. And we all wanted to give service to people. That's one of our goals. So if you really looking for real service, you should learn, not just because it's not just about everybody doing the same thing. It may not work. Will ashwagandha work for everybody? It depends on your prakriti, body type, etc. So you have to really, it's a very personalized medicine. So it's better you get, connected with a Siddha doctor and get the right diagnosis. Today there are methods you can do things from remote. We have been doing this very successfully for past several years. And if you want anything further, so we are going to expand this knowledge because there is a need for this. It's all they're seeing that it's working, and just that the government, because they are not able to publish like how the modern, because the construct of the science is different. You cannot just publish like how the modern science do, the publishers. So therefore, it doesn't mean they are not curing. Every day, it's a lot of people see their doctors. I have seen a lot of cases, many cases here now. I'm just piled up. So I'm not able to handle this. So we are expanding this because we need more doctors everywhere. There is a lot of people are in stress and there is a need. And this is how we have to go forward. And we'll, bring all the Siddha knowledge, and you can learn, and we all can solve the problems of the world, through Siddha knowledge. So I thank you, Dr. Dr. Kayalvizhi, for the wonderful session. So we'll close it here. Thank you. So next week with a different
Thank you everyone
topic.
for attending.
And yeah, so just a quick announcement. So we have Siddha psychology courses. We have a webinar coming this week for preparation through art, for the fall. You attend this, it's a lot of things covered there. So we have a Siddha doctor who has so much experience in seasons, what kind of food you eat for seasons. It's a 2-hour workshop. It's not very expensive also. It's around $27 you pay, and then you're in on Saturday. So please make use of this opportunity. Look at Siddha-Vetha.org, www.siddha-vetha.org. Thank you all. Have a wonderful rest of the wonderful night. Okay, bye. Good night.